very much for the introduction and for having me. So on the slide, you can see the beautiful University of Glasgow, where I work in Scotland, on a nice peaceful day. And I'll talk to you a little bit about what sustainable healthcare is, because it's not something that a lot of people have come across. So hopefully that will be informative. If I'm boring you because you all know it already, then interrupt me. I'm going to try and make it a little bit interactive as well. So do kind of put things on the chat or raise your hands or ask questions. First, I have to declare my conflicts of interest. So for the NG initiative, we have funding from the Sustainable Markets Initiative companies listed here. And I also partner with some organizations as well. So part one, I'm just going to give you some definitions so that we know what we're talking about. And this is where we start with the interactivity. Can you raise your hand on the Zoom? You put your raise button if you know what sustainable healthcare is. And that will also give me an idea. So there's a little hand, or if you have your video, you can put it up. Okay, so not too many. Okay, well, that's quite good because that means today's talk will be informative. But the next question is, keep your hand raised if you think you could give a definition of sustainable healthcare, which, oh, some hands, all the hands have gone down, which is exactly what happens normally when I give a talk like that, because we all think we know what sustainable healthcare, but actually what is it exactly? It's hard to define. If anyone has any ideas, you could put it in the chat or speak, but since everyone put their hand down, I'm probably going to move ahead to telling you the definition. So sustainable healthcare, a definition, is that it's about improving the health of patients in the present. So the patients you see in front of you right now, but without compromising the health and well-being of current and future generations. So it's about looking after the health of the patient that's come in for some treatment or care without damaging the health of anyone else currently alive or future people. So hopefully that's a nice, simple definition. So what is health? If we're going to look after the health of patients now without damaging the health of patients in the future, the WHO definition, which dates back to a few decades ago, is that health is a state of complete physical, mental, and social well-being, not merely the absence of disease or infirmity. So health is not just not having a disease, it's being well, having well-being. And it's not just physical, not just the biological health, but also the mental and the social well-being. So all of that is encompassed in the definition of health according to the WHO, and which is the definition that sustainable healthcare takes. And that definition comes from the biopsychosocial model of health, where health, and that's from Engel in the 70s, where health is the biological factors, but it's also impacted by the psychological and the social factors as well. But there are other factors that impact health. So apart from our psychological, biological, and social aspects, what else do you think impacts health? Again, I'm going to try and make this interactive. If there's anyone who wants to put anything in the chat or say something, you can do so. I'll wait for a couple of minutes. Or maybe not all 2 minutes, but 30 seconds. Environment, yes. And air, yes. And our health resources, yes, as well. Excellent. Air pollution, hospitals, yes, water, socioeconomic factors, excellent, good. So we all understand that there's a lot more to health than that, than just this model. And that's where the, oh, why is this not working? Oh, it's because I'm in the chat. There we go. And so I've put them like this. So these factors look at your human health, but there is another model called One Health, which I'll explain if you haven't heard of it before, which is an integrated, unifying approach that balances sustainable health by balancing the health of people, animals, and ecosystems. So the environment was mentioned in the chat, as well as water, as well as air pollution, but also housing, hospitals. So all of the infrastructures would be part of the environment. And I don't think anyone mentioned animals, but maybe that comes into um, environment. I can explain how they impact human health as well. But yeah, the concept of One Health is that the health of humans is interlinked with the health of the environment and of animals as well. So that's One Health, and therefore topics of interest in the One Health model would be things like antimicrobial resistance, so resistance that comes from animals receiving antibiotics that are then consumed by humans and vice versa, and antimicrobials ending up in the soil, for example. You have all the zoonotic diseases like COVID, which we all know about recently, but plenty of others like Ebola, avian influenza, rabies. So that's all the diseases that come from animals into humans, all the vector-borne diseases that come through vectors like mosquitoes, ticks, lice, or uh, to give us diseases like dengue fever, West Nile virus, etc. So that depends on the environment and the animals' health around us as well. All the food safety issues like norovirus, salmonella, things like that. Plant health as well. There might be issues to human health caused by pesticides, herbicides, and such things that are used on plants that are grown for us to eat. And there's also diseases. It's not much of it is known yet, but plant diseases and crop diseases will impact crop production, which will impact humans as well. Um, by through nutrition. And then environmental health, which is some of the things we mentioned in the chat. So the quality of the water, of the air, of the soil, and climate change all impacts human health as well. And then following on from that, there's a newer concept called planetary health, which was coined by the Rockefeller Foundation in 2015. It coincided with the launch of the United Nations Sustainable Development Goals, which I'm hoping most of you will have heard about. And essentially, planetary health is the concept that the health of human civilizations and the natural systems on which they depend. So in another way, sorry. Um, It's an exciting opportunity for finding alternative solutions for a better or more resilient future. If we look at it that way, and I have a little image here to show what it looks like. So we're looking at here, hopefully you can see my mouse. You've got your human health of one human that's related to public health, which is the health of a community, which is related to global health, so that's the health of everybody on Earth. And then you have One Health, which is looking at the health of everyone on Earth, but also the health of animals and plants and the environment around them. And then you have planetary health, which includes more than that and includes the climate and the societal systems we have built, for example. So it's a very solutions-oriented transdisciplinary field. So it's looking for solutions from lots of different fields. And it's focused on analyzing and addressing the impacts of human disruptions to Earth's natural systems on human health and all life on Earth. So it's looking at all of the impacts that we've had and how they impact our health. Hopefully that makes sense, and that's a definition for something that I might use. So in part two, I will talk about the biggest threat to health. So again, if we can look on the chat, according to the United Nations and the World Health Organization, there is one single biggest threat to human health. And what do you think that might be? Okay, someone said climate change. Anyone on CO2? Yes, and then we're getting thumbs up from climate change. Yeah, climate change with an exclamation mark. Very good. Yes, it is climate change. So we'll stop the chat. Very good. It is climate change. Climate change is the single biggest risk to human health, not because it creates any new diseases or new conditions, but because it multiplies the ones that exist already. So it's called a multiplier of risk. And these are some of the things that it can cause that will impact our health. Politicians, you've said as well in the chat. Yes, I'm hoping that they can also be part of the solution. Um, this is how does climate change impact health? Not everyone always knows, but these are some of the examples. So, for example, you have the classic air pollution, where you might get increased asthma. You get increased allergies and more severe allergies. Same with the asthma. There's increasing rates, but also increasing severity. Um, Air pollution is linked to respiratory diseases, but less people know that air pollution increases cardiovascular diseases as well. So, for example, in the world, about 25% of strokes and 25% of heart attacks are due to air pollution. So it doesn't just impact respiratory conditions, but also cardiovascular ones. Extreme heat is, I'm sure you have much more knowledge of this in Spain than we do up here in Scotland, but it is a cause of death, particularly in very young or more elderly people. Droughts can impact water supplies, which can cause all sorts of water-related conditions and infections, as well as malnutrition and food shortages. Environmental degradation, you've got your wildfires and your smoke, which can cause loss of homes, which has a big impact on people's well-being, and also cardiovascular and respiratory diseases. You've got your changes in vector ecology, for example. So I'm sure again in Spain, you're much more aware of this than we are up here in Scotland, but a lot of vector-borne viruses, for example, are spreading north and entering Europe. So things like dengue fever, the tiger mosquitoes that are cropping up in Europe and starting to arrive in England as well. In Scotland, it's mostly Lyme disease that we're seeing. So Lyme disease is a disease of ticks in this country, and it's becoming a much bigger problem because the ticks are not dying in the winter like they used to. So they used to die, and the Lyme disease pathogens would die with them. But they are now overwintering and then spreading in the spring. So that's becoming a big issue. Um, Food systems are impacted. So we get food insecurity, malnutrition, and some foodborne illnesses when people eat over over things because of the high food prices. I think in Spain, I don't need to tell you about severe weather and floods. I think you're unfortunately well aware of that. And water quality impacts. So algal blooms, for example, we're getting them more and more here, even in Scotland, but I'm sure you will have them in Spain as well. So these are some of the examples of how climate change and its impacts on the weather impacts health in a number of different ways. And it's not just biological health, but social health and mental health as well. So the impact of that for medical education is that we need to make sure that our medical students, but wherever you work, if you're working with nurses or other health professional students, they need to be aware of this threat to health so that they can be prepared to diagnose and treat any illnesses that are becoming more common or spreading to different areas. Or due to severe weather conditions, but they can also act as change agents. They can advocate for change, and they can also find innovative solutions. So I'm actually covering this topic at the moment with some students, and we've just moved on from talking about the risk and why climate change is bad to all of the innovative solutions that are being done locally. And there are so many little solutions being done here and there at small scales. And then, if these are successful, they can be implemented at larger scale. So the health professionals, medical students in my case, can be really big um, actors and players in trying to find and enact solutions to this. Okay, no, nothing in chat, just checking. Okay, so I'll move on to part 3. What's the impact of the healthcare system on climate change? And I think we're going to go into the chat again. So what do you think in terms of percentage is the healthcare system's contribution to greenhouse gas emissions? And as a reference point, aviation is about 1.2%. So if aviation's 1.2%, what do you think the healthcare system is? Okay, we've got 5% already, 25%. 5%, 10. Okay, all right. 5%. So you're all going for much higher than aviation, which is correct, but unusual. So you're obviously very well informed already. So this is a graph that I have found for Spain. So your sector is about 1.2% and the healthcare sector is 4.5%. So with your 5%, you were very, very close. And it tends to be 5 to 7%. I think 3% in the UK, all the way up to 10% in America. Um, so yes, globally it's about 5 to 7%. So if the healthcare sector was a country, it would be the 5th largest polluter on Earth. But I don't need to tell you this since you all got it pretty correct in the chat. This is a graph for the UK, but I'm going to guess that it'll be similar for other European countries. This is where the greenhouse gas emissions come from. They come mostly from medicines and chemicals that are prescribed and medical equipment, the supply chain as well, and also a little bit from anesthetic gases and metered-dose inhalers, building, water, and travel. This is another way to present it. So you can see that acute, which is in the hospitals, this is where most of the dots are. And again, it's mostly medicines, medical equipment, a little bit about food and construction. And in primary care, so this is our general practice, family doctors, you might call them. Um, they are mostly chemicals as well, and this is for the asthma inhalers. Um, I don't think I say this later in the talk, but asthma inhalers have a very large carbon footprint, and they are mostly prescribed by the family doctors. And these are actions that are being taken in the UK. So firstly, there's scope 1, so they're trying to make better healthcare facilities, trying to change to reduce fossil fuels and change to solar and other types of heat sources. We're trying to change the anesthetics gases that we're using so that we're using some that are less emit less greenhouse gases, and also all of the cars and vehicles that are used to transport things around are changing to electricity. And then we have scope 2 and 3, which is all of the surrounding impacts. So things like waste, water, the metered dose inhalers that are prescribed, for example. So there's a lot of action, and it started in scope 1, and then we're looking at scope 2 and scope 3 as well. So these are lots of examples. Solar panels, we have a net zero hospitals, anesthetics gases are recycled, cars are going electric. This is the metered dose inhaler that I was talking about. So this is the inhalers for asthma. So they release about as much greenhouse gases going from London to Sheffield, which are two cities very far apart, 175 miles, whereas they could be replaced by dry powder inhalers, which have a much smaller carbon footprint, for example. Yes, and waste treatment and trying to reduce PPE, which is the masks and gloves, for example, that people use in aprons. So the impact for medical education of this, again, students need to be aware, and in my case, it's medical students, but any students need to be aware that the healthcare sector has such a big impact on climate change. And the reason why they need to be aware of this is so that they can practice sustainable healthcare when they become clinicians. And hopefully by putting it into the curriculum, we can allow this awareness to happen. And this is just to show you that the principles of sustainable healthcare, if we're going to talk to students about what they can do clinically, the best thing they can do is prevention. So if they give advice to patients to prevent them getting certain conditions or prevent conditions getting worse, then there's less people needing healthcare, and then the healthcare system can have a reduced impact, and that's the most effective. Patient empowerment is getting the patients involved and the patients having a say in what they want, and when they want it, so that things are not prescribed or done automatically, but in conversation with the patient. I think now we actually say patient agency, rather than patient empowerment. So it's not just giving them a little bit of power, it's actually letting them be the decider, and you give them the advice. Lean systems is the other thing. So having patients go in just once instead of having to go for a test and then come back the next day for results, for example. So they go in just once and it happens more efficiently and more effectively. And they have tests done just once instead of having them done once in one place and then repeated in another place. And then it's low carbon options like switching inhalers, for example, and then it's operational resource management. So that's the things that make the most impact. And I've put this little river from Spain in here because the analogy that I've heard used and that works very well is at the moment the clinicians are learning to treat the disease that are coming at them. So it's a bit like they're pulling people out of the river. But there's more and more people going into the river, so there's more and more people to get out of the river, and that's what climate change is doing because it's increasing the health burden. So there's more and more people being ill, so there's more and more people to drag out of the river, but no one's asking who's pushing the people in the river upstream. So that's what we need to do. We need to prevent and stop people being pushed in the river so there's less people to pull out, if that makes sense as an analogy. So that's what sustainable healthcare is, having less people, more people well, and less people needing healthcare. In the UK, we've started to put this into the guidelines for clinicians. So this is the General Medical Council. So they license the doctors. And they have a document called Good Medical Practice. This is what doctors should do. And it says that they have to be sustainable. They have to take account of the wider population. So that's the definition of sustainable healthcare, that they have to look after the patient, but without making all of the people who are not at the doctors sicker. And they should choose sustainable solutions when they can, and they need to support the reduction of the environmental impact on healthcare. So it's starting to be in the guidance, which is good. And in terms of education, this is again from the regulators. We have outcomes for graduates. So these are all of the outcomes that our medical students have to achieve by the time they finish medical school. And in there, you can see that there is sustainable healthcare in there. So the students have to know about improving health and sustainable healthcare. They have to know about the principles of sustainable healthcare, which are the ones that I've just outlined. They have to know about how ecology, environment, and occupational hazards impact ill health. And they have to know about the impact that global changes have on local health. So they have to know about the impact of climate change on health and well-being in Scotland, for example. So this is for the UK only, but there is an Amy consensus statement about planetary health and education for sustainable healthcare. That was published in 2021. And Amy is an association of medical educators. So there are some, it's not guidelines, but there is a consensus statement on what should be included there. And again, if we go back to UK, we have a curriculum in the UK, but it is widely, it is open. Anyone can access it, so anyone can use it if they want to. I think what's important if you're going to include this in medical education is not to make it a separate topic. So it's not, you don't want your normal lectures and then you just add in a lecture on climate change. It has to be integrated into everything. You can see that in quality improvements, for example, sustainability is not apart from it, it's part of what you do clinically. So I think sustainability has to be really integrated. So when you're talking about treatment, you talk about the impact on the environment. When you're talking about the cardiovascular system, you talk about the impact of heat, etc. Sorry, I'll just drink. Well, of course, that is the harder way to do it. It's much, much easier to get an expert in and give them one or two lectures, and then that's it done. You've put it into the curriculum. And that's a good way to start. And it's a good way to get going. But I think the aim should be that eventually it's just integrated. It's just you're teaching students how to do sustainable healthcare, not how to do healthcare and how to do sustainability separately, but all together. Um, but that's going to be hard to do. And so in terms of action for education for sustainable healthcare, we have launched in October a new European network on climate and health education. It's chaired by myself and our vice principal of the university, Professor Ian McInnes at Glasgow. We are in partnership with the Global Consortium on Climate and Health Education, which is from Columbia in New York. And it's funded by the Sustainable Markets Initiative. And the aims of the network is to collaborate across Europe for undergraduate medical schools. So we're staying quite focused. I know that it's a topic that's also important to other health professionals and also to postgraduate clinicians. But we want to stay smaller and more focused in the first instance so that we can get to know each other and get more action done. But our aims is to help each other to include climate and health in the medical curriculum, and that includes in assessments, because if you only put it in the teaching but not in the assessment, the students are not going to pay attention. We're hoping to share experts, so there's not many experts on the different topics across Europe yet, but if we have, one in Barcelona, one in Glasgow, we could share, if there's one on air pollution in Barcelona and one on ticks and tick-borne diseases here, we could share so that both universities benefit until there's enough experts around who can teach locally. We also want to create joint resources or share ones that exist so that we don't all have to recreate the same teaching for the same topics, which will make it easier, hopefully, to integrate to the curriculum, because then you might just have to adapt or choose the ones that fit your own particular curriculum. And very importantly, we want to support faculty development. So I think a very strong message that we're getting is that the faculty are really infused. They really want to put this into the curriculum, but they feel like they don't know enough to do this. So I think we're going to build a little program of faculty development to increase the confidence of all the lecturers and teachers so that they have the confidence to put it into the curriculum. And we're going to work together to advocate for its inclusion, just like it is in some of our documents in the UK, so that it's included in the accrediting body or regulatory body or licensing bodies documents, so that it's not a choice for medical schools to include this anymore, but it is part of the national requirements. So that's the aims of the network. If you're interested, there's plenty of other initiatives where you can find more information, and I've put them all on here. And since recorded, you can read them in your own time. And yeah, I think I would like to finish by saying that Mary Robinson, who was president of Ireland, I had a chat with her and she said, what if our best world is still in front of us? She's very much an advocate of sustainability. And, you know, she thinks, and I agree, that by doing all this work, by working to prevent climate change and make sustainable healthcare, we're actually going to get hopefully better health, better well-being, and lead to a better world than we currently have. So I think we need to also have hope that environmental engagement, especially among young people, can help us create a better world. And definitely when I teach this topic, I try and put a positive message on rather than negative. I think that's it. So here's my email address. So if you are interested in joining the network, then send me an email and I can give you more information or send you the link. It needs to be signed on at the level of the dean of the medical school, and that's to make sure that they commit to putting it into the curriculum. But then usually we have a rep who will work with the network to do that. Yeah, any questions?
Thank you very much, Camille. We have Carlota Lasallas. Puedes preguntar.
Sorry, I just didn't mean to ask anything. I was just showing an emoji of clapping because the talk was really good.
Okay. Oh yeah, it was
Thank
a
you.
wonderful talk.
I see a question in the chat. I can answer it.
Yes.
Someone said they're
So there
surprised.
was an important point that you stressed at the end. Not only schools, we have to talk to the agencies that accreditate the study plans, the curriculums in our school. So in Spain, we
Yes.
have several agencies at the national level and at the autonomic level. So I think it's important that we have also a call to these guys, and so because so you said that in the UK now all this information is mandatory in the curriculum of the schools, or
So
not
there's
exactly?
a little bit, not all of it, but
Okay.
they have to be aware of environmental factors and the impact of climate change. So it is a little bit. I think there's a new curriculum being or a new outcomes for graduates being prepared, and there's a new exam. We have a new licensing exam that starts officially this year, where all the
Uh-huh.
medical schools will take the same exam. All the students from all the medical schools take the same exam. So we need to make sure it's included everywhere. So there's still work to do, but it's been a start. And I think probably in other countries, that's how it would be. You start by including a little bit, and then you can maybe build on
Yeah.
that.
And
But
the
yeah.
important point is to increase awareness at all levels, not just by doing a course, a conference, but in every aspect of our work, that we are aware and tell the problems that we have at hand to help them, ¿no? ¿Alguna
Yeah.
preguntita más? Any question? ¿Alguien quiere preguntar algo? A ver si algunas de las decanas que hay por aquí se apuntan.
Hi,
There are some deans. Adelante, Mireia.
yes, well, I wrote the question in the chat,
Yes.
but I can also ask here. Yeah, it's about the impact of the asthma treatment. I was very surprised about it, and I would say that first, before this presentation, I would have said that antibiotics have a higher impact than inhalers. And yeah, I was curious about these numbers and whether you have a reference for it.
Yeah, so the data from the inhalers is from it's from several places. The little picture with the car, that comes from some materials that's been made for patients by Greener Practice, which is a kind of a network of family doctors, general practitioners we call them, who work in the UK, because if you want to help patients switch inhalers, you need to give them the information first and discuss it with them. So that's where the graphic comes from. The data comes from the NHS itself and their from their policy on net zero. So the NHS has a target of net zero and they've published a document. So I can send you a link to that later on. But the reason the inhalers have such a high impact is the gas that's in them is a few thousand times more potent than carbon dioxide. So even though it's not much gas, it's very, very potent greenhouse gas emitter because the gas that's in it is so potent, a bit like the anesthetics gases as well. They are very, very potent, much more so. Again, I think it's thousands of times more than carbon dioxide. So switching to a different gas that is not more potent than carbon dioxide is reducing the greenhouse effect. I think antimicrobial resistance has a big impact on the environment, but that's the graph that I showed was the impact on greenhouse gas emissions only. Does that answer the question?
Yes, yes. Thank you very much.
Yeah, no problem.
So that was like CFC, no? Some 10, 15 years ago, CFC was retired from all the aerosols, and so, but now it looks like such a tiny inhaler has such a big effect.
Yes,
Incredible.
yeah, which is very surprising to most people. It's definitely very surprising to most patients when you tell them. So there's, you know, when you're saying we need to tell everybody, we need to at all levels, we also need to make the patients aware.
Yeah.
And again, the best thing, you need to be careful. The best thing to do is to make sure asthma is well controlled, because then the patients don't go into hospital and they don't have an asthma attack.
Mhm.
Because if they go into hospital and have an asthma attack, then you're into huge amounts of CO2 because hospitalizations release so much greenhouse gas emissions. So the dry powder inhalers, for example, that have a much lower carbon footprint, the patient has to suck in the medicine, whereas with the meter dose inhaler, it goes in, the meter dose does the forcing in. So for some patients like young children or people who have respiratory difficulties, then the powder inhalers is not ideal because
Yeah.
they're not able to take it properly. But for patients who can switch, if you talk to them, then the idea is that they could switch, and that would reduce the NHS or the carbon footprint of the healthcare system for us.
Carlota?
Hello. Yes. Now I think I do have a question. Thank you for the talk. And in a moment of the talk, you mentioned that education should be provided to students, but also
Yes,
to teachers.
yes,
I wonder, because I work in a university that has a faculty of health sciences with their different specialties, and I guess that one of the problems because of this subject is not integrated into the curriculum is because teachers, they don't feel that they have enough training or knowledge. And
yes.
what are other universities, or what do you, or the literature suggests to tackle this issue?
Yeah, so it's to have workshops and webinars with your faculty. So, you know, bring in an expert. That's what I've done in Glasgow. I brought in an expert who explained to some of the faculty this topic and how they could teach it. And then we talked together. But yes, it's a big problem because especially at university, you know, lecturers like to really know something very well in order to teach it. It makes sense. And this is not something that was in the curriculum that anyone learned. It's very new. Um, so you also have to be able to approach it more collaboratively with the students so that you're learning a little bit ahead of the students, and you're getting the students to do some of the research as well. So for example, the module I'm running at the moment, the students are going to present new innovations that have come up in the past couple of years. And I'm hoping that they'll bring a lot of new innovations that I haven't heard of yet, but they've been researching and trying to find some. But you know, they know this, we've discussed this, a new topic, and I won't know everything, but we're going to discover some of what's going on together. So partly some teaching, just, you know, teaching about all the facts. Some universities, Cambridge, have done little fact sheets for the lectures. So for example, for the lecturer who gives a lecture on asthma, they will have made a little fact sheets with the main important points for the lecturer to know in order to be able to integrate it. And then she's done the same for all of the other specialties so that they could be integrated by the experts without them having to spend lots and lots of time learning. And yeah, I've also brought in a student. So in a couple of weeks, I've got a student who was a student with us a couple of years ago, but she's now a doctor, but she's very knowledgeable in this topic. So she's coming back to teach the students as well. So
Very
I
good.
use ex-students as well. But yeah, slowly teach the teachers, and through the network, I'm hoping we'll build some, you know, some resources for faculty development. So whether that's presentations that you can give, or videos that they can watch, or fact sheets that they can use.
Okay. I think we have to remember that you said that there were a lot of resources in the NCH, so we can try to get information and learning by ourselves, because we may be aware of the problems, but how to teach, how to make the students aware of the situation. So you have this professors development, no? Teachers
Yes,
development. So yeah, I think that we
yes.
can, in the previous slide, probably I think it was. Yeah.
Yeah, I've put this slide here.
Oh, okay,
Um,
here, see,
yeah,
the first one, no? Yeah.
yeah, exactly. The first one has some resources already. They're global. So what parts of the European network will be to either modify these to be European or create
Mm-hmm.
some that are European specific. But this website here has resources that exist for
Yeah.
teaching. The other thing they have, if you want faculty development or develop yourself, they do have a European course. They call them for climate first aid responders. And they have a part one course that ran a few months ago, but it's still accessible anytime.
Oh,
And
very good.
then building on that, they've got like a level 2 course that's starting very soon. So once
Very
you've
good.
done the first one, and you want to learn more, then you could go
Mm-hmm.
on to the level 2 one, because it's a very, very complex topic.
Oh, yeah,
So you know, it's not something you can learn by watching a video for an hour and then you
of
know
course,
everything there is to know,
of course.
unfortunately. So, but yeah, I definitely recommend. Obviously, I'm partnering with the GCCHE, so I'm biased, but they are very good and they have a lot of resources, and their courses are really, really good. I've heard a lot of positive comments about the courses. But all of these websites have got resources as well.
Very good. Okay, there's one question in the chat.
Oh, yes.
What could be the impact of neglected infectious diseases on sustainable healthcare education?
Oh, on the education. Um, I mean, the impact on health is big, because a lot of these will spread wider or have longer seasons. So the impact of these will be greater. And if they stay neglected, then obviously the impact is not going to be restricted in any way. So I think they probably can't stay neglected for very long. The impact on education is that they'll have to become part of the curriculum if they spread more. So, we'll have to start teaching about the signs of dengue fever more in Europe than we do currently, for example, and how to treat it.
Okay, very good. Is there any more questions?
If you think of questions later, feel free to email me.
Yeah, of course. Well, thank you very much, Camille. It was a pleasure for us to have you here and teach us about this big problem and how can we attack with our students and in our schools. I hope that we can all get the job done and and it
Yes.
improves a little bit in the future.
Yes, thank you.
Well,
Yeah, I hope so. I hope collaboration will help. And even though the network that I'm chair of is only for medical schools,
yeah,
undergraduate medical school, and I would love more medical schools to join. If you're interested but not part of a medical school, join the
yeah.
GCCHE. They cover the whole globe and all health professions.
Okay.
So they're much bigger. Healthcare Without Harm also covers a lot of professions. So there are other networks that you can join as well. And again, if you want questions, then just send them to
Very
me by
good.
email. I'll put it up again.
Okay, very good. Well, but thank you very much and goodbye.
Yeah,
Perhaps to see
goodbye.
you in the future.
Yes, thank you. You too. Have a good evening,
Gracias.
everyone.
Gracias, adiós. Bueno, vamos a terminar el seminar, el webinar. Mañana lo tendremos en el vídeo en la página web de SEDEN. We'll have the video tomorrow in SEDEN. I'll send you an email, Camille.
Oh,
Thank you very
great.
much. Bye bye.
Thanks. Bye bye.